Guess who's back? That's right, it's me, Prudence. I'm here to guide self-funded fiduciaries and their ABC teams, advisors, brokers, and consultants. In this video, we'll be discussing provider billing and fraud. Because of the successes that Medicare and Medicaid have had in combating provider fraud, fraudulent providers have turned their attention to group health plans, the next biggest pot of gold after Medicare and Medicaid. If you didn't already know, provider fraud is on the rise. While fraudulent providers are a tiny fraction of the provider community, that small minority can definitely have an impact on plan costs. The initial challenge that a plan fiduciary faces is how to identify the few bad apples without bothering the vast majority of providers who care for their patients and whom we trust. Health Decisions has the tools and techniques fiduciaries need to isolate those bad apples. Unfortunately, payers from coast to coast have taken steps to bar plan fiduciaries from questioning provider billings. Check your Administrative Services Agreement or any accompanying PPO agreement. In one or both of these documents, you are likely to find language that prevents you from contacting providers. The folks at Health Decisions started seeing this language about 10 to 15 years ago, and it is now common in most agreements. The provisions barring plan contact with providers are being used by payers to bar plan fiduciaries from even questioning any provider's billing practices. If you have the audacity to question the provider billings, the standard answer you receive is the payment is consistent with our provider PPO agreement. And when you ask to see the provider PPO agreement, you are told you can't see it because the plan is not a signatory. Some payers point to their provider fraud and abuse unit, but none will tell you if any cases impact your plan. Again, they'll cite provider contract limits. Pretty slick, huh? Providers and payers can agree on how to spend plan assets, not tell the fiduciary what the agreement is, and if questioned, tell the fiduciary to take a hike. Prudence says, look out for fraud and provider billing. Health Decisions is looking for early adopters among group health plan fiduciaries willing to address this issue. The ultimate goal is to establish partnerships with payers to fight provider fraud. Interested? Call 1-855-PRU-SAYS and ask for me, Prudence.